Hi, I'm Dr. Michael Harbison, and I'm here today to talk to you a little bit about thyroid and thyroid conditions. The thyroid and thyroid conditions are very complex but are plaguing today's society. A lot of this has to do with the way we live our lifestyles, the food that we eat, the lack of sleep that we get, the fact that our society today is always on the go and we're always being stimulated. Very rarely do we get a chance to actually calm down. Even though you think you're calming down, you have your TV going, your computer or your tablet is going, your phone is going. You have all these different stimuluses that are occurring all at the same time, which are continuing to keep your body or your mind going, which is also stressing out your thyroid and your adrenal glands. The basics of the thyroid, which any of you who have a thyroid condition more than likely already know, the one that your doctor always will run a test for is your TSH, or your thyroid stimulating hormone. Now, your thyroid stimulating hormone is secreted by the pituitary gland, and that is secreted to tell the thyroid, hey, I need some of your hormone. So the thyroid then releases T3 and T4 thyroid hormone. T3 is only about 7% of what is released, but is the only one that is able to be utilized by every cell in the body. Every single cell in the human body has a receptor for T3 because that is the active and usable form of thyroid hormone. So what happens to that other 93% that's made into T4? Well, that's a good question. That is transported into the liver, where 60% of that 94% is converted into some form of T3. And as you can tell by this handy dandy chart over here, the T3 that is converted, there's 3 different forms, and it averages out to be about 20% apiece. With that being said, most doctors will test as well the T4 and your T3. Some will actually test a little more extensive. If you're dealing with a thyroid condition, whether it be Hashimoto's, Graves', hypothyroid, hyperthyroid, you also need to look at the TPO and the TPG hormones, or I'm sorry, not hormones, but transporters and converters. The TPO is what actually transfers the thyroid hormone into the cell so that it can be used, and TPG actually converts it into the usable form and gets it ready to be used. Now there's also free T3, free T4, reverse T3, which is made in the liver, and then there's also T3 uptake. These testings should also be ran with your blood labs, especially if you're wondering if you're having some kind of thyroid issue. Because the bottom line with thyroid conditions, most of the time it is a multiple system condition. So once the thyroid starts to fatigue, or the thyroid starting to dysfunction and not function properly, or starting to be attacked by the antibodies, next thing you know, other systems of the body start to dysfunction and other systems of the body start to fatigue. And all of a sudden you start to get this cascade of events. So it starts off with chronic fatigue, you're tired, different things like that, maybe some brain fog in there. And then all of a sudden different aspects of your body start to dysfunction. Maybe your kidneys aren't doing as well, or your liver's not doing as well, or maybe you're getting some heart palpitations now that you weren't ever experiencing before in your life. And a whole cascade of things can start to happen. And the thing is that with the way healthcare is right now, your primary care physician does not necessarily have the opportunity to be able to spend the time with you, to be able to explain all this to you. Your primary care physician is driven mainly by the insurance companies on what they can test, what they can do for you, and also the pharmaceutical companies on what they can prescribe you or what they can give you. And that really puts the chains around your primary care physician as far as being able to be your physician and treat your condition, because not every single one of these thyroid conditions is a cookie cutter. If it were that way, then all of all of you that are being treated right now would be getting better versus always staying in a rut or seemingly continuing to have more things dysfunction within your body. And then the doctor's answer seems to always be, well, let's up your prescription, or let's give you another prescription for this, or let's do this for this, or this prescription for this. The testing that needs to be done is very extensive, and if your primary care physician orders it, it's very expensive because the markup that they have to do to keep those large buildings and large offices going is pretty extreme. With that being said, most of the time your primary care physician is not doing thorough enough testing to actually get to the root of your problem. And then on top of that, even the testing that you do have done, they spend minimal time explaining it to you. When was the last time your medical doctor has ever sat down with you and actually explained to you what your blood labs mean? Explain to you, hey, by this number being elevated, this actually shows that your kidneys are dysfunctioning or your adrenal glands are dysfunctioning, and this is why. See, that's the key right there. This is why. Explaining to you why these are dysfunctioning so you can take the necessary steps that you need to take to actually change your life and change the way to which your current situation is taking you. The only way to change what is happening in your body is to change the way you're living your life, or change the things that you're doing, or find out the true cause of the problem and address that cause. We have a whole wide array of testing that we can do. With that being said, we do not order the same testing for everybody. There's obviously always a foundation of testing that is going to be done, but also there's going to be specific testing for you. Some people may get allergy testing, some people may not. Some people may get adrenal test, some of you may not. Some people may get gut testing to see how their gut wall is and the gut integrity is, and some people may not. It's all about you. Your testing, your treatment, the explanations to you about your condition, it's catered to you. It's not catered to everybody. This is very specific treatment for you and your body. Not everybody is the same, so not everybody should be treated the same. If you feel as though you're getting inadequate help, or you would like to come find some answers about your thyroid condition, give us a call. Set up a consultation, and let's get started getting you your life back.